Good evening all, respected doctors and dear colleagues. Myself, Harish Mehta, working as Assistant General Manager in InnoCare Life Sciences Private Limited. On behalf of InnoCare Life Sciences, I welcome you all. It's our great honor and privilege to welcome you all for the first Indian Medical Cannabis Advisory Board meeting at Delhi. So this is the fourth advisory board meeting which we are doing today. Earlier we have conducted same advisory board with the doctors at Bombay. Then we have conducted in Chennai. This is third and the fourth we are conducting at Kolkata. Your presence today marks a significant steps in shaping the future of pain management and patient care in India. It's an honor to have great personalities among us from the orthopedic fraternity, Dr. Arun Goyal sir, who is as a chairperson for this event. Welcome sir. Dr. D.K. Chauhan as a moderator. Dr. Vijay Dev sir, who is the medical advisor and the coordinator of today's event. Welcome sir. And Mr. Dipin Verma, who is the director of InnoCare. Welcome sir. So before starting the meeting, we invite all the esteemed guests for a lamp lighting. I request Dr. Arun Goyal sir, Dr. Vijay Dev sir, Dr. Raju Gala is not there, Dr. Raju Gala is also coming, and Dr. Manoj Bhatt sir. Please join here for a lamp lighting. Thank you, sir. Now I request Mr. Dipin Verma, who is the director of the company, to come on the dais and share overview about the InnoCare company.
Thank you, Harish. Good evening, doctors. Myself, Dipin Verma, Director, InnoCare Life Sciences. I also extend my warm wishes and welcome you all to this very uniquely conducted Cannabis Advisory Board meeting at Delhi. And I'm very sure that the today's discussion is going to be very fruitful and it's going to throw a lot of insights in the use of medical cannabis. So before we get into the discussion mode, we will be, I just want to give you a little bit brief about the company. InnoCare Life Sciences started in the year 2014 end in Mumbai, in Chembur, in Maharashtra. We are one of the leading players in the nutraceutical segment, in the natural segment, natural nutrient segment you can say. And sir, at InnovCare, we are committed to the very high quality, research-backed, innovative healthcare solution that targeted the lifestyle-related disorders. And with a robust pan-India presence, we are an all-India-based company, and InnovCare has a dedicated sales force of more than 500 sales professionals, promoting our products to more than 25,000 healthcare professionals. That includes specialties like orthopedics, gynecology, diabetologist, also some cardiologist, and also we have a segment we promote to sexologist also, and internal medicines. Sir, in this scintillating journey of over 10 years, we have managed to have more than millions of happy customers as we comply with all quality standards and regulatory certified manufacturing units. So we make we proud ourselves in launching first time in India brands with world-class technologies, and which is now, as I mentioned, trusted more than 25,000 healthcare professionals. And so there are millions of happy consumers till now in the last 10 years. We follow all the WHO GMP guidelines, FSSAI guidelines, ISO guidelines, and also all the safety guidelines as per HACCP. And also we provide halal certificate as and when it's required. So our main focus areas are bone and joint segment, women's health, and lifestyle disorders. Our vision is to, and aspiration is to become #1 nutraceutical company with a focus on preventive measures in bone and joint, women's health, and general wellness. And bone and joint being are really the #1 segment for us. In fact, more than 50% of our revenue comes from the bone and joint segment. Sir, we are, as I mentioned, we are an all-India based company. We have a presence of more than 20 consignee agents, which is spread across all over India. And we operate through more than 600 stockists. And today we are present at more than 36,000 retailers. And also we are present on online platforms, which are today currently being used by consumers and the patients. Sir, we partner with very highly trained professional manufacturing plants which follow WHO CGMP standards, which are US FDA approved plants, which are UK approved plants, and which are European approved agency plants, which help in getting us the best of the medicine products, and we really do not compromise in any way on the quality of the products. Even though we are a nutraceutical company, but we follow standards which is meant for the pharmaceutical, the highest quality pharmaceutical standards. That is the reason why today we are one of the leading players in orthopedic, in gynecology, internal medicine, general wellness, diabetology, and also in sexual health. Of course, we are more towards in the supportive health. In orthopedics, sir, you must have known our well-known brands like TendoShot Pro, LigaShot, ColaShot range. We have an Instaflex range with our hardcore drug range. We have also launched a very innovative calcium molecule with RichCal Bio. And today now we are recently we have also launched our InstaActive range. This is first initially we launched with a non-cannabis source, and now we have come out with the actual original cannabis source in the form of InstaActive range, which is oil, patch, gel, immersed gel form. And also now we can say that we are proudly presenting InstaActive spray also, which gives a very good results in topical pain management. So in the internal medicine segment, we have a brand called T3, T3LC, T3D3, T3 Plus, T3 Ala, and now InstaActive PL. Okay, now which is now widely prescribed by you all. No therapy or no overall treatment is complete without having the sexual wellness being the part of it. So we proudly say that we also offer a sexual wellness products called eDrive, eDrive C, and eDrive MX, which are our flagship brands in this segment. Also been very well accepted in the doctors' fraternity and also by the patients. Sir, we are also a very significant player in Gynec and IVF segment. So our brand like Medinofol, Inofol, HB, Fertilix OVA, and also T3 MG Even in the skin and hair segment also we have launched Cola Shot Glow, and also in bone health segment Rich Care Bio. So this basically helps us in giving you a full range of products in the healthcare segments. T3 is our #1 brand, followed by Tendo Shot and Cola Shot, and Liga Shot and Instaactive, which is in ortho and physician. In gynac segment, we have got Inofol, EFEM, and in sexology segment, we have got eDrive, and in infertility, we have a flagship brand is Fertilix Over. So we are proudly in the last couple of years, we have been promoting, and you have been supporting us right from the beginning on Instaactive Fort, which is acting on an endocannabinoid system, but not a cannabis source. And this gave us the encouragement to launch the pure cannabis, which we will be having a more discussion in this advisory board meetings. So recently introducing the medical cannabis in the modern medicine, the first brand which is now in the market is Instaactive Oil, pain relief oil, which I think already my team has already come and introduced to you, and you may have also tried a few of the patients. And initial feedback is really very positive. But we have got so many questions, so many queries in our mind, which we would like to discuss in this sort of a meeting. So we thought that we should organize this meeting and have a good discussion. So we are in the pipeline is Instaactive Pain Relief Patch, which is a breakthrough in this segment. Very soon this patch will be available in the market. Instaactive Vimal Gel is already there in the market. Right now we are introducing it. And also only one oral therapy that we are introducing in the respiratory segment, that's cough syrup. It may not be directly concerning with you, but just for your information, that is also in the pipeline. Sir, before we get into the deep dive into our presentations, I also would like to mention that we are one of the very few companies, and rather the only nutraceutical company, which does a clinical trials on our combinations. We have done clinical trials on Cola Shot C2+, on Liga Shot, Tendo Shot Pro, and Fertilix Ova is an ongoing trial. Today, when we will discuss about the medical cannabis, Instaactive Oil and Instaactive Spray and Instaactive Vimal Gel, we will be showing you the clinical evidences where we have done the trials, and it is already the results have come out, and very soon it will be getting published in an index journal. So we are in the industry, we are recipient of the Brand Excellence Awards from the AWACS and also from the other consulting groups. So we have received awards, and we are very proudly say that in a short time we have received your blessings and admiration from the industry colleagues, so that we could get such an award. And these award is not ours, this basically is yours and the patients award, because those patients have really given us that kind of encouragement and given us that support that you have supported us all through, and which has helped us in getting to this stature. But I would say that this is just a beginning for us, and we will be going, we want to climb a lot, want to offer a lot more innovative solutions in healthcare, in supportive health, in pain management, and on all the segments where you have the challenges in the today. So one of the pain management challenges that we have is to treat as with the minimal side effects, with the minimal intervention. Okay, so that is where we are going to be discussing about the medical cannabis part. So I always take pride in InnovCare being the service provider for innovative healthcare solutions, and I'm sure you will agree with me, and we will definitely be happy to discuss about more of medical cannabis in this meeting. So I thank you very much, sir, with this for patient hearing, and with this I would like to invite Dr. Bijoy Dev. Dr. Bijoy Dev is a medical director for InnovCare, and also he's been a very experienced medical doctor. He's an MD medicine from Kolkata Medical College, and he has done immense work in I would say the clinical practice as well as clinical trials part. He's been instrumental in getting this cannabis, medical cannabis in the modern medicine, and we have got all the due approvals and everything with his help, and that will really, so we are very fortunate that he's there amongst us, and been guiding us all through. And so I request sir to please come and take this session forward. Sir.
Good evening, Doctor. See, I would like to welcome all of you to attend this ad board meeting, and we would like to give more time and your expertise, even also your willingness to collaborate with us. Even in your busy schedule, you have come over here to attend this ad board meeting. Thank you for the same. Today's discussion will be on cannabis sativa, the extract, the medical cannabis, not for recreational purpose, only for the medical purpose. We'll discuss on chronic pain management. Also, this cannabis is being used nowadays in case of your epilepsy, also in case of sleep disorder and depressions. Now here we'll mostly discuss about the chronic pain, that the effectivity of cannabis and the side effects and other aspects. Now, why this advisory board meeting? And what is this advisory board? If we look into that, ad board basically a structure and complaint forum for clinical discussion. And the purpose of this particular ad board meeting is to get the insight from all of you and to make a strategy with the real world needs. Now, I would like to tell that whatever the insight we'll get from this particular discussion, that will be published in the form of letter to the editor, particularly in the first page of the journal. Second one is the medical bulletin in the medical news category. And the third one is the most important. It will be published in the form of review article. This review article will be published in the Indian Journal of Orthopedics and the International Journal of Orthopedics.
No, you say it.
Now, particularly in case of your ad board meeting, we are talking about the chronic pain remains is a major quality of life issues. If we see that conventional therapies has a lot of shortcomings and side effects. Now, if we take into consideration in our practice, we are using non-steroidal anti-inflammatory drugs. Now, this non-steroidal anti-inflammatory drugs, we have a selective COX-2 inhibitor and non-selective COX-2 inhibitor. Now, if we take into consideration non-selective COX-2 inhibitor, yes, the pain is being controlled, but there is a lot of side effects. We know the GI irritation, nephrotoxicity, even also we come across sometimes the problem of the coagulation of blood. Then we have switched over to your selective COX-2 inhibitor. Selective COX-2 inhibitor doesn't have all those problems because of its selectivity. But major problem is that we have come across in our day-to-day practice, that is the QT interval prolongation. And because of that, there is a cardiac arrhythmia. In the past, we have seen that rofecoxib, valdecoxib, those of selective COX-2 inhibitor, it was launched in the market. But later on, it has been withdrawn because of the QT interval prolongations. Now, later on, we have received the etorecoxib. We have got the palmicoxib. Now, both the drugs are under scanner because anytime it can be withdrawn. So, if etorecoxib and palmicoxib have been withdrawn from the market, then we do not have any selective COX-2 inhibitor in our hand. Now, coming to the opioids. Opioids, really, it is good drugs for giving pain relief, but major problem is the respiratory depression. I'm not taking into consideration constipation, habit formation, that I'm not taking into consideration, but respiratory depression is the major problem. When the opioid derivatives that has come, that is tapentadol or tramadol, there is no such problem we'll come across, but the major problem is the nausea, vomiting and reeling sensation, vertigo. In some patient, it has been found so much that the patient is not in a position to tolerate these things. So why I'm telling this thing, that we have a lot of drugs for pain management, but still we are searching for drug, or we require certain adjuvant therapy which will be really very effective for taking care of the chronic pain. So here basically we would like to explore this cannabis. Now particularly this cannabis, there is a lot of confusions we have at the back of the mind. Because we know that cannabis is being used for recreational purpose. Yes, worldwide if you take into consideration that in case of your Canada, it is for recreational purpose as well as medicinal purpose. But if you go to US and European country, it is being used as a medicinal purpose. West Germany also it is being used as a medicinal purpose. Once again you go to Latin, that is Uruguay, there it is being used as a medicinal purpose as well as your recreational purpose. Now, major thing is that in India, if you take into consideration, India basically has been approved cannabis as a medicinal purpose, not for the recreational purpose. And that is also, they have approved only cannabis sativa. And cannabis sativa, if we take into consideration this plant, you will find that it has a flowers, it has a leaves, it's a seeds. But which particular part has been approved by Government of India? The Government of India has approved only the leaves extract, not your flowers. Okay. Now, if we take into consideration leaf extract, there is 100 cannabinoids is there. Out of these 100 cannabinoids, 2 cannabinoids actually have been taken into consideration particularly for cannabis extract. One is CBD, second one is THC. Now there also they have specified what should be the ratio. What should be the ratio of CBD and what should be the ratio of your THC. Particularly when we are going for chronic pain, then CBD concentration should be higher side rather than your THC. And it is also being used particularly your anxiety disorder and sleep deprivations, or in case of your depression, there obviously THC concentration will be higher side as compared to your CBD. Now at this juncture, we have a lot of things at the back of our mind. When we'll discuss one by one, then we'll be able to understand that why this cannabis is required and how it will be very effective for taking care of chronic pain management. So this particular ad board meeting, we would like to capture your expertise, your opinion, your clinical experience, and that will take into consideration if there is clinical trial and other aspects, patient education if it is required, that also will be taken into consideration. Now, if I summarize the entire things, then this particular chronic pain remains a burden and we require innovations. I have already discussed that what are the pain management drugs available in our hand, and I have also told that their positive side, their negative side. So obviously we require further exploring of newer pain management drug or adjuvant which will be really effective for taking care of the pain management. Still, cannabis is a very effective option, but debatable. Still, it is debatable. That's why we require a ad board meeting. We would like to know your expertise, your opinion, so that how we can take it further forward. So, we value your time and insight for attending this ad board meeting. So, thank you very much. Let's lead the future of pain care together. And sir, I would like to request from your end, if you have anything in your practice, you have come across this medical cannabis, or you have anything at the back of your mind that if you would like to know regarding this cannabis, its use and other things, then after that I will show you the clinical trial. Even also I will talk about the formats, which are the formats we can take into consideration.
First,
Hello. 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 Hello.
It's a nice presentation. When you talked about the cannabis sativa,
Yes.
it is already in use by homeopathic people. The homeopathy people started the use of sativa long back, and they were using it for anxiety and mental disorders. This is one thing. Do you think that you still recommend it for the use of anxiety and mental disorder?
See, sir, I have told you that when the extract will be taken, there are a lot of cannabinoids are there. The two major cannabinoids we are taking into consideration, that is your THC and CBD. You have rightly said when it will be for anxiety disorder and your depression and sleep deprivations, there obviously THC concentration should be higher side as compared to CBD. Generally, in case of pain management, the ratio is 1:2. That means if I take one part of THC, then I have to take 2 part of CBD. So pain management CBD concentration is higher side, and in case of your THC is the lower side. Now, if we take into consideration THC and CBD, all of us know that we have an endocannabinoid system.
Because in that dosage,
I'm sorry,
Okay.
we have an endocannabinoid system. Now, endocannabinoid system basically consists of 2 receptors, CB1 and CB2 receptor. Basically, when the CB2 receptor will be stimulated, there will be no psychoactive effect. It will take care of your pain management. When there is an activation of CB1 receptor, generally we get the psychoactive effect. So when we are increasing the CBD concentration, basically CBD activates your CB2 receptor. When CB2 receptor will be stimulated, on the contrary, there will be no formation of 2 cytokines. One is interleukin 6 and another one is TNF alpha. Not only that, when this CB2 receptor will be activated, there will be a further activation of NF-κB, nuclear factor kappa beta, will be reduced. So there will be no further formation of your interleukin 6 and TNF alpha. So the pain will be taken care of. Here you will find that there will be not much activation of CB1 because CBD will be higher side. Sir, here we are mainly focusing particularly for chronic pain. In case of your epilepsy and sleep disorder, or in case of depression, we have not taken into consideration because our formulations, if you take into consideration, you will find the CBD concentration is higher side rather than your THC.
so you are only going to concentrate on pain,
Pain management.
not on other parts of it.
No, that's
The
we are not
CNS,
going for.
as is on the effect on CNS.
See, I would like to tell you, sir, we are not coming with the tincture right at the moment. Suppose in case of your epilepsy, if we look into that, then we have to come with the sublingual tincture. Okay, that we have not focused, but a lot of companies, they are coming with this oral tincture, sublingual tincture. Yes, you have rightly said that yes, it can be used in case of your sleep deprivation, also sleep disorder, and in case of epilepsy too. But there the THC concentration will be higher side.
Because many years back, when
Insight is yours.
in Ayurvedic, they were using it for schizophrenia, for mental disorder, anxiety, and in that dosage, the complication rate, like constipation, headache, loss of appetite was very high. But that depends upon which molecule you are going to use.
Yes. Second one is that during that period, cannabis sativa, it has not been used. If you look into that, you will find that this is cannabis indica. Cannabis indica, it has not been approved in India. Okay. Only cannabis sativa, it has been approved, and that is also leaf extract. And it is very safe as compared to that.
Sativa is being used by homeopathic people also.
Yes.
But they are using it in a very small
Yes.
dose, which is
Absolutely.
very safe. And they are using only for schizophrenia and anxiety.
Yes.
What is the difference between indica and sativa?
See, sir, in case of your indica, when you are taking the extract, you have to take the extract from of 1:2. very difficult. Even also, in case of your cannabis sativa, flowers, it has not been approved. Flowers, it has a very high concentration of THC. You will find that your marijuana and all those things, that is from the flower. Okay, but this cannabis sativa leaf extract, there you will find the CBD concentration is very high, and we are taking more concentration of CBD rather than THC. Because when THC concentration will be higher, then action on the CB1 receptor will be more. Then, see, actually CB1 receptor, it is found in your brain and spinal cord. And CB2 receptor, basically it is found in the periphery. So we require the more stimulation of CB2 receptor so that this cytokines, that is interleukin 6 and TNF alpha, should not be produced, and there should not be activation of nuclear factor kappa beta, so that further formation of interleukin 6 and TNF alpha can be taken care of.
What part of cannabis being used since ancient times by all the sadhus and people who mix it, use it during holy time or other times? What part of it is used?
They have used flower, they have used seed. You have, for example, bhang.
They have used both.
So they have used leaves, they have not used to that extent, rather than they have used your flower, they have used seed to that extent. But it has been found that leaf extract, basically it is giving you more CBD as compared to your THC. And when the chronic pain, it has been taken into consideration, and it has been found that this is the extract of your, I will show you the clinical trial, there you will be able to see that it is better than your opioid derivatives and opioids.
So what is Dhatura? Dhatura is part of the seed of the same plant.
No. This is a different thing. And this is different.
That is marijuana.
You,
That is marijuana.
The leaves have been used, basically in so many variations like Namkapara and all those, basically using the leaves.
no, sir, Vang, sometimes it is also.
They are mostly leaves.
Yes, sir. Leaves
Yes.
are, sir, leaves are used, and leaves are ethical and allowed in India now.
Now,
So-
leaves, when you are taking into consideration.
Long back also, sir, leaves were used. Yes.
But when you are taking into consideration at the time of manufacturing, you have to look into that, what concentration you are keeping. Because leaves also, when you take the extract, THC will be there, CBD will be there, but your CBD concentration should be 2 times more than your THC. Because THC concentration, when it goes up, then it affects on the CV1 receptor. But when CBD will be more, then it acts on your CV2 receptor, so your psychoactive effect and all those things will be not
Yes, sir.
You are
The
getting
earlier.
the-
Yeah, you are right, sir.
there. Right.
Yes, sir.
Right,
yes.
right.
Yes, sir. Yes.
Yes.
You
You are
are
right,
using the
yes, yes, sir. Yes, sir. Yes.
you are using the leaves only.
Leaves, only
Now,
leaves.
Cannabinoids is available also in just a moment.
ठंडाई में आपका भांग.
That's leaves only.
हाँ.
Cannabinoids is available also in other forms, say kali mirch. It is available in coffee, tea leaves also.
See, I'd like to tell you, sir,
side
Those
camera
this
things-
particularly, this particular things,
You are
that
taking-
you are rightly said that also this beta carotene. See, there are 3 things are there. Now
Yes.
I'm going in depth. Okay, when you are asking this cannabinoids, terpenoids, and flavonoids.
Yes.
Okay, this is the terpenoid is the beta caryophyllene. Now this beta caryophyllene you can get from the cannabis source, as well as you can get from the non-cannabis source. Okay, non-cannabis source you have right clove oil and kali mirch. There are 2 sources are there. You can get the beta caryophyllene, that is terpenoid. But when we extract from your kali mirch, the concentration is very low. It does not give much therapeutic benefit. Then we have taken into consideration the clove. Clove, the beta caryophyllene concentration is very high, and it gives very good effect. The beta caryophyllene, you can see that in case of Instactive 4, that we have extracted from clove. That concentration is
Yes.
very high, and that is the terpenoid. It is not cannabinoid.
No, but your this pain relief oil,
Hmm.
it contains
Cannabinoids. That is your cannabis.
not clove.
No, no.
And anything else with this?
Sir,
Because
the tablet form contains the Cygium aromaticum, that's clove, and also the spray form, sir.
Why I'm asking this thing?
This is, sir,
because
is-
the absorption through the skin is very poor.
Hmm.
In order to increase the absorption, you need something else to be added on this.
See, it is not only that your cannabis sativa extract, it has been taken into consideration. If you see that this particular formulations, we have used the counter irritant. Counter irritant use required.
Then only it will help.
Counter
Yes.
irritant because it,
Otherwise, all such it will
Huh.
not.
Yes, counter irritant basically it dilates the blood vessels over there, and there will be a more blood circulations. So your kinetic energy converts into your heat energy. It opens the pores of the skin and it helps in better penetration. Yes, of course, there should be capsaicin. There should be methyl salicylate. These are the counter irritant. If you see that there is a Goltharia. Goltharia is nothing but your methyl
I
salicylate.
can't read that too small.
Yes, sir.
Yes, it is there.
It's there, sir.
It is there.
Reading in your composition, I think besides the cannabis, all other ingredients are pretty well known
Yes, sir.
to exhibit analgesic effect.
Yes.
Yes, sir.
So how much do you attribute the analgesic effect to
Cannabis, yeah.
and the rest of the other things which are pretty well known to give pain relief?
Yes. Sir, if you take into consideration Goltharia, Goltharia is basically a methyl salicylate. It basically a COX-2 inhibitor. Okay. Now there is a eucalyptus oil. Eucalyptus oil, it acts as a local anesthetic. Okay. Now when you are giving Broswellia, it acts on LOX, lipoxygenase pathway. Also, it inhibits HLE. Capsaicin, which basically are anti-substance P drug. So we are taking into consideration the entire pain pathway so that it will give you really a very good effect.
So have you done any comparison
Yes.
if you were to take out cannabis from this composition and have rest of the products vis-a-vis how much would be the difference?
See, I would like to tell you, sir. That's why we have compared with Dr. Ortho oil. Dr. Ortho oil, it has all those in the ingredients. Only that cannabis is not there. And we have compared. What are the parameters we have taken into consideration? First, we have taken into consideration VAS score. We have taken into consideration OMAC. And we have taken into consideration 3 inflammatory markers, CRP, ESR, and ABR. It has been found that in all the cases, the reduction of your inflammatory marker is better with this cannabis formulations as compared to your Dr. Orthobel. Then we also checked that onset of action and duration of action. Onset of action is faster with this oil as compared to Dr. Ortho oil.
So Dr. Ortho oil is the inspiration behind this product.
No, it is not the inspiration. Inspiration is that we are using opioid when there is a severe pain. Particularly the inspiration has come 2 things. One is chronic pain and also cancer pain. Cancer pain is so severe, whatever medications we have, we use pentagocin, pethidine, everything. Even after that also the patient says that I do not have the relief. And it has been found that your cannabis is really very effective, particularly in case of cancer pain, chronic pain and acute pain.
Why did you compare this with the Dr. Octo? It's just a proprietary, you see, advice on media.
Why? Yes, sir. I will give you the answer. Right. We have in gel, cannabis gel, we have compared with this as a standard. Because I have to see also the commercial part. So commercial part also, if I take into consideration, means
Well, I think Dr. Bijoy, if the contents of today's meeting gets out to Dr. Ortho oil, their chest will really become 56 inches. If you are comparing the product with Dr. Ortho oil, there is no better compliment to them. And my question is,
So I'm
next
not
question
going
is,
for
have you
this thing.
compared your patch,
pura discussion ho gaya.
हाँ नहीं रहते
have you compared your cannabis patch with the buprenorphine patch in cancer
No.
patients?
We have decided to do the clinical trial with fentanyl. fentanyl patches, and this your cannabis patch. We will do the clinical trial very shortly, but here we are facing one particular problem. You know that now clinical trial, earlier it have to get the EC approval, ethics committee approval. This ethics committee approval, when you are comparing the drug vis-a-vis, after all, it is from your plant source, the extract it has been taken. You have to give a lot of answer for the same. So once we get the ethics committee approval, we have to go for CTRA registration. Once CTRA registration it has been done, as because we are comparing with the drug, so we have to take the approval from DCGI. So from DCGI approval, I have to upload the entire content to the Sugam portal, and there will be a lot of queries will come from DCGI. If I can satisfy, then I can take up these things for clinical trial.
That
So-
is the legal part of it.
Yes.
Besides leaving the legal part of it, how this patch is going to penetrate the skin?
See, sir,
That drug.
I would like to tell you.
Because there are some markers of cannabinoid in the skin also. I do understand, but the penetration would not be so deep.
Now, sir, in case of your skin also, if you see that the CV1 and CV2 receptor is there.
Are there, I understand.
there.
But in spite of that, it does not penetrate so deep.
No, sir, actually, if you see that is a cannabis patch also, only cannabis extract is not there. Along with that, counter irritant also we have added to that.
In a patch, you are going to use the counter irritant also.
Yes, of course. Otherwise, your penetration will be a little bit difficult. So, from the epidermal layer, the drug should at least go to your dermal layer. So, that we have to see. Otherwise, how the pain will be relieved to that extent.
Now, as a painkiller, when you are going to use cannabis, what side effect do you expect?
See, particularly in case of your cannabis, you are talking about the oral form. Oral form, we have 3 options. One is capsule, second one is tablet, and third one is your gummies. 3 formats are available. Now, how much we have to give? That dosage is also 250 milligram. Okay, 250 milligram twice daily, so 500 milligram per day. Now, particularly if you ask me, nephrotoxicity, GI irritations, problem of the coagulation of blood, then QT interval prolongation, cardiac arrhythmia, respiratory depression, these are the things will not come across. A single, because in case of whatever the studies are there in case of cannabis, it has not been found that it increases QT interval prolongation and it leads to cardiac arrhythmia or no GI, because it doesn't have any effect on your COX-1. So there is no question of your GI irritations.
It is recommended that it should not be used with anticoagulants. If somebody is using anticoagulant, cannabis is not indicated. Should not be used.
But there is no evidence, clinical trial is not there. Because right at the moment, whatever the clinical trial it has been carried out, particularly in case of your cannabis, there are total 7 clinical trials it has been done. And all the clinical trials I have, and there it has not been found that this, even also the patient is taking clopidogrel, and suppose I am giving this thing, yes, no, there is no.
But in German literature, it is written there. Have you gone through German literature?
Yes, I have gone through the entire things, but I have not found that particularly in case of your cannabis, it's contraindicated. That way they have not mentioned anywhere else.
May I, sir, intervene? My respect and regard to Dr. Goel, sir. Sir, मैं चौहान साहब का बेटा D.K. चौहान.
I know you.
Thank you, sir. Sir has been a teacher for all of us from Delhi. Sir, this is a cytochrome P system stimulator. And that is why you have rightly said that it does have some interactions with oral anticoagulants of the yesteryear. This clopidogrel is an anti-platelet agent. We are not talking of that. We are talking of oral anticoagulant. Of course, it will have some interactions with vitamin K antagonists.
Now, if we look at most of the people, like sir, you also must be using, newer oral anticoagulants. They are, like Rovor or Eliquis. There it won't have a significant interaction. Secondly, being a CYP4 stimulator, it will have some sort of interactions, but the kind of dosage in which this will be given is quite less, might not be of clinical significance. Regarding, sir, the skin penetration part, all patches are made with a vehicle. So the first thing a patch does is increase the porosity of the skin where it is kept. Then the vehicle dissolves the active drug and then it helps penetration. The amount of penetration and its graduation, how long or how fast it will be released, that pharmacodynamics the company should be able to tell.
And another thing is that, sir has rightly said, Apexaven, Rivaroxaven, there is no interaction. No interaction. Rivaroxaven and Apexaven, it has not been found. So that way.
Cardiologists would start with warfarin and then switch over to the newer molecule.
Not necessarily, sir. Nowadays, warfarin is indicated only in valvular AF. Right? If
Yes.
there is no valvular AF and you are dealing with an AF case or maybe a VTE or a thromboembolic episode of any nature or a leg coagulation or whatever, you can safely give one of these NOACs. Why give the warfarin? And then go on chasing, PTINR or patte mat kha, gobi mat kha, all those things.
Right, absolutely.
Would your company have the permission to sell this product in Punjab or not?
Obviously. But
Sir, we have taken a free sale certificate to market it in all over the country, and also we have a permission now even to export also, sir. So, yes, sir. So we have permission to market it all over the country, sir. No, sir, we are going to be promoting this only to the modern medicine doctors, sir.
Sir, I would like to tell you that, sir, it has been kept, Government of India has kept in Schedule E1. Schedule E1 category they have kept. So it is no question of promoting to Ayurvedic doctor. It will be promoted to your... yeah, okay. Sir, that way if you...
Sir, that's only because, sir, it is approved only right now in Ayush category and in special E1 category. So,
In early 70s,
yes.
when there was no any analgesics to treat myocardial infarction patients,
Hmm.
morphine was used left and right, and we did not find any significant side effects to morphine, right? And opiates were considered to be the life-saving at that time. Except for constipation, there was nothing much side effects were reported. So, as far as I am concerned, I have used it in a large number of patients with less of the side effects.
See, sir, in case of morphine, the major problem is the respiratory depression.
But we have not come, I have not come across, at least in
It's
my...
good, sir.
in
You
my
have not come across. It's really very good.
Yeah.
Because...
And, you see, I have a post-graduate from AIMS, Delhi. At that time, you see, they were using it in large numbers of patients.
Yes, maybe there is, during that period, options were not there. Now there are newer drugs are coming, newer options are coming, which is more effective and the side effects wise is less. So we have to.
That warfarin is only used for valvular heart disease, not for other things.
Yes. Thank you. I would like to call Dr. D.K. Chauhan to come over here, and his topics will be the role of cannabis sativa in chronic pain management and its significance. Thank you, doctor. You take up this.
Thank you so much. I think a lot has been talked about, and my task has been made a little easy. So we can run the slides. So chronic pain, we all know, it's not a pain for the patient, it's a pain for the doctors also to resolve it. And it's prevalent and debilitating condition. Conventional treatments include, as sir was rightly pointing out, opioids, which was used mainly in acute pain of MI, one of the worst pains, 3 milligram IV. I also used it very often. MI aate hi oxygen, morphine, Lasix, This was standard. Sote mein se uthao and you start doing this. Whatever. Then emerging interest is there in alternative therapies, and cannabis sativa is one of that. So these are the three variants of the same plant, the cannabis, sativa, indica, and rudralis. These all indica and rudralis looks much Indian, Rudra se and India se, and it is Rudra's favorite plant as well. So now coming to the little bit of science in it, so we have basically two things here, cannabidols and the THC, tetrahydrocannabinol. On the right is your CNS acting part, and on the left is your peripheral acting part. So these are the various parts of the plant, and you can see the chemical which is of interest to us, the CBD and THC, they are in highest concentration in the leaves, and rest of the parts of the plant, they don't have a high concentrations, especially if you look at the root or the stem, it doesn't have much, maybe a little bit more in the seeds. So if anybody, and all of us must have seen ganja in our college days, और गांजे दो प्रकार के बिकते थे, एक सूखी पत्ती के और एक बीज वाले. बीज वाला थोड़ा सस्ता था, सो बीज में भी है, और यही चीज है. So this is the endocannabinoid system, and mota moti taur pe it is divided into two parts, the CB1 and CB2. CB1, if we you see, it's easy to remember this way. One is CNS, which is on the top part, and CB1 is the one for the CNS and the nervous system. CB2 is for the periphery, and that is where our interest lies. Our interest doesn't lie much in the CB1 part. So this is the mechanism of pain relief, which we all know. Cannabis activates CB1 and 2 receptors. The medicinal product will be acting much more on CB2 vis-a-vis CB1. It reduces pain perception. So it's not going to do much to the basic pathology. It is how you perceive the pain. This is our understanding as of now. But later on it might change, because cannabis receptors are there in the immune system, in the peripherally circulating white blood cells, it is there in the thymus, it is there in the spleen, it is there in the liver, it is there in the testes, it is there in the seminal vesicles, it is there in the ovaries. It's a ubiquitous system, and it modulates neurotransmitter releases. A large part of it lies in the gut also, and maybe someday it may be used for appetite regulation. If you remember, Remonabant had come. Remonabant is a derivative of cannabis only. Of course, it got withdrawn from the market because of its CNS side effects. Again, a cannabis derivative. We are still in the stage of understanding it. It decreases inflammation and oxidative stress. So this is the second part of it. First we said it is acting at the pain perception, but it does decrease inflammation and oxidative part also. So maybe at the basic mechanism, the root cause of the pain might also get addressed. So these are the medical benefits. The best benefit is reduction of anxiety and depression, which is almost 30% in the population of Delhi. It does reduce inflammation only partly. There are just a few papers spread here and there. Migraine, nausea, pain, psychosis or mental disorders, seizures. Seizures is the only approved indication, especially the Gus-Stock-Lennox seizures, where it was first approved by FDA to be used, and that is where it started all from. Now the clinical evidence is supported in neuropathic pain, fibromyalgia, MS-related pain, RA. If we look at the upper three, they are much related to the mind and body both. Rheumatoid arthritis is another place. Of course, pain is a perceived phenomenon. So anything which alters your perception is going to alter your pain feeling. So there is a significant pain score reduction, and if you look at cannabis versus opioids, there is a less risk of dependency, no lethal overdose. Not as yet. As yet people have not found कि कितनी भांग पीने से बंदा मरेगा. Probably मरने से पहले बेहोश हो जाता है वो. And it is effective for neuropathic and inflammatory pain as well. So these are the various forms which are available: oils, tinctures, capsules, edibles, vapes and topical creams. And people do take cannabis on their own without a vape also. They just roll it and use it in chillum. And 3 of the formulations are there on your tables as well. So looking at the safety and side effects: dry mouth, dizziness, fatigue. This does occur. And the THC part can lead to euphoria, anxiety and cognitive impairment. Why cognitive impairment? Because these CB1 receptors are much more ubiquitous in the prefrontal cortex, and the happiness comes from the effects on amygdala and hypothalamus. Tolerance does develop over time. That is true with anything which acts on your CNS. And in this, another thing which has not been written in the side effect part, people can get dysphoretic reactions and paranoia also. And paranoia is one thing which is a very dangerous thing. And anybody and everybody who has, I'll call it a substance use when it comes to that level, can have suicidal tendencies also. Though this has not been reported with cannabis, but one should be aware chronic use and very large doses can lead to this. This was one of the reasons why Remanaband got withdrawn from the market. It was a modified product of cannabis. So in conclusion, I have done it a little fast because we are already running late. It's a promising option for chronic pain, and I have used it in a couple of my patients, the oil part, and it does start giving relief within a week. It has a multimodal mechanism, and the dependency part is much lower if we compare it vis-a-vis, morphine or alcohol. There is an ongoing research and policy evolution. A big role has been found of cannabis in urogenital infections, and in for the pain management of lower urinary tract symptoms, the LUTs. And of course, it has got both positive and negative effects on the male sexual functions. There are some concerns about testicular cancer also. But you see, it's an evolving field which we all will be going through collectively. Thank you. Thank you.
Now I would like to call over here, that is Dr. Sanjay Kapoor, MBBSD Ortho MS and MCH USA, the role of medical cannabis in chronic pain management.
Good evening, everyone. More or less, this is a revision of sort. Already much has been told about the molecule, and I am here to just share my experience regarding the role of this cannabis and where I am using it in chronic pain management cases. So it's a pain, as you all know, is a global burden, and most of the patients we see in our OPDs, they come with pain, whether it's a joint pain, whether it's a chronic pain. And there is a limitations are there as such with all kinds of conventional analgesics, vis-a-vis all kinds of side effects and the duration, the onset of actions. So why cannabis? So this molecule I have been using for last say 2 to 3 years now, mostly in the form of the local application, sublingual form as well as oral forms. So the overview, the cannabis sativa indica, they are the key strains in this. And as already been discussed, that it may be acting on the THC, which is a cytoactive, basically centrally acting, and CBD, which is a non-cytoactive part. Other cannabinoids, CBG, CBG, CBN, they are present in the leaf, but in very, very less amount. So there is no question of acting on the central system. Again, if we come to the endocannabinoid system, as we discussed in the last lecture, there are 2 kinds of receptors which is acting on CB1 and CB2. So the CB1 is the central and the CB2 is the peripheral, and mostly this cannabis leaf extract is not acting on the central, not acting much on the central system, but on the peripheral system it is acting, where all kinds of pain receptors are there. So these are the formats which are available worldwide, but not in India. In India, mostly we have oral forms, sublingual and topical forms. And I think in a few months or so, the transdermal, or I think it has already been introduced, the transdermal patches. The route of the onset time, as we see in the oral, it's around 30 to 90 minutes, and duration is 4 to 8 hours. Sublingual, 15 to 45 minutes is the onset time, and the duration is 4 to 6 hours. And topical forms, it varies, and it's a localized kind of action. So its role in acute pain, it's very limited evidence we have in regular acute pain, and mostly we don't prefer to use this in acute pain scenario. We are right now, the evidence is there in the chronic pain management, and we are using in the chronic pain cases. So it's effective in certain post-operative or trauma-related pain, but not much of a use, not in my practice at least. So the main route which is preferred is sublingual route, which we are using in our practice. And the combination with opioid, if we combine with it, it may reduce the dose of opioid. So in the role in chronic pain, it's a definite role. A lot of studies already been done, and it's coming out. There is evidence in cases of chronic pain management. The cannabis is playing a good role and giving results, especially in neuropathic pain, fibromyalgia, cancer, and arthritis. So the oral and transdermal formats are ideal for sustained relief, and it may reduce reliance on NSAIDs and opioids. In epilepsy, I don't have any kind of experience in using epilepsy, but it's already been approved in cases of epilepsy. It's the only indication which has been approved. And there is an emerging evidence is coming out in the post-traumatic stress disorders, anxiety, Parkinson's, and cancer-related symptoms. Smoking and vaping, this is not, the formulation is not available here in India. And abroad it has been used, and vaping is preferred over smoking, obviously because of the potential side effects over smoking. Gummies are also available, but I think it's not available here in India. And no. So basically the format which we have is the tablet form, the sublingual, and the oral, which is ideal for chronic conditions. Because the thing is that when you are using this cannabis oral formulations, the sublingual formulation, apart from the peripheral acting, it is definitely acting on some kind of central receptors, because the patient, most of the patient who is coming in the OPD with chronic pain, with some kinds of anxiety or some kind of depressive symptoms, they are getting much of the relief. So in my practice, I'm basically using this format, the sublingual as well as oral, only in the chronic pain kind of a patient with depression and with anxiety kind of symptom. It's giving good results in my practice. So the sublingual, it's a medium onset and duration is there, as we discussed before also. It is directly absorbed into bloodstream. We should always start with a low dose, not with a high dose. Start with 2 drops or 3 drops sublingually, and gradually we can increase to up to say 5 to 6 drops also, twice or thrice a day. So the formulation sublingual, its weak strength is also available, in strong strength it's also available. So depending on the patient, we can formulate the kind of treatment we want. We can go for the medium dose, and we can go for strong dose. And I have not faced any kind of side effect with the sublingual forms. Even if the patient is taking say 10 to 18 drops per day in different doses, then also it's very safe and no side effect can be seen. The topical applications, many formulations are available right now, starting from creams, balms, lotion, oils, and it has been used especially in knee arthritis patient, as well as in neuropathic kind of patients. So there is no psychoactive effect in that, and there is a minimal systemic absorption. So it's a very, very safe kind of an application. Transdermal patches has been recently introduced, but I have not used this delivery system. So it's the benefit, they are saying that there is a constant cannabinoid delivery is there. It avoids peaks and troughs, and the steady state is maintained, and the compliance is very easy. Because in oral formulation, sometimes patient, if it takes many drops, say if we say 3 drops, the dose titration is difficult, they take more dose, so it can be difficult. But in transdermal, that kind of scenario is not created. So it's a slow onset, and So the main principle, the dosing and titration, the main principle is to be followed is start slow, go slow principle. An individual approach, the dosage can be adjusted as per the need of the patient. And we should consider this THC and CBD ratio. Most of the formulations is acting on the CBD, and the CBD is dominant and less psychoactive side effects are there. So we need a balanced approach, and I feel with this oral formulation, with sublingual formulation, the both kinds of the neuropathic kind of pain as well as the pain due to say other arthritis patient, even in rheumatoid and fibromyalgia kind of patients, this cannabis can be used. Side effects, I don't think there is any kind of side effect I have faced or we have faced, the other doctors have faced with this CBD, and there is not much of a monitoring is needed. It's a very, very safe kind of a system. So if we compare with other formulations, the inflammatory action is pretty good, and analgesic is also good. Side effect is very moderate. Side effects, if we see, sometimes the patient may complain of some kind of bradycardia or some kind of dizziness, but it can be easily handled. We ask the patient to take sufficient hydration, take a rest. Then these kind of side, which is very, very rare, is handled very easily. So dependency risk, I don't think there is much of a dependency risk in this. So it's a moderate, it's mentioned. So we have to educate the patient, because there is a lot of misconception. They say this is cannabis and equate with bhang and all. But the thing we have to just confirm with the patient. We have to just counsel the patient. There is no such side effects is there, and it's a total medicinal kind of formulations. So for choice and format will be based on the pain and the type and duration, the patient preferences, what kind of formulation he wants, and what are the comorbidities. But this is comparatively safe in all scenarios. So not much of a monitoring is essential. So I thank you all. Thank you.
Thank you. Regarding formats, this gummies is available. We have not brought, but the gummies is available in India now. Okay, oral form, tablet, capsules, and gummies. These three. So now the last topics is legalization of cannabis use for medical. I would like to call upon over here, that is Dr. Raju Kalra. An overview: global trends, benefit, challenges, and legal landscape.
Welcome.
Thank you, Doctor.
Good evening to respected seniors and dear colleagues. Right. So, talking about legalization of cannabis use for medicinal use. The first fear in patients is it easily available? Is it safe for them? So, this is the first thing, that are we allowed to use it? Because it's actually Ayush. So, like they can use allopathic, we can also use Ayurvedic. So the introduction is cannabis. It's a psychoactive drug from the cannabis plant used for medicinal, recreational, and industrial purposes. There's an increasing global interest in the cannabis legalization. The focus of presentation will be on legal, medical, economical, and social perspectives. With cannabis and its uses, we have to realize what part is legal and what is illegal. For medical, you're using it for pain relief, epilepsy, cancer-related symptoms, and multiple sclerosis. Recreational, psychoactive experience and relaxation is out of our course. Industrial, they are using it for the hemp, textiles, papers, biodegradable plastics, and building materials. Now, the key compounds in cannabis, like they've already discussed, THC, tetrahydrocannabinol. This is the psychoactive agent used in pain relief and nausea restriction. CBD is the cannabidiol, non-psychotic, used for anxiety, inflammation, and seizures control. The evolution of cannabis to medical cannabis, like the endocannabinoid system, this plays an important role in regulating stress and pain perception. How did we get to the use of cannabis? Cannabis was introduced in modern science in 1845. It was listed in the USP as an analgesic and antispasmodic between 1854 to 1942. The Marijuana Tax Act came up, and cannabis became illegal in 1937. So this has all happened around World War I and II. Discovery of THC as a compound and how it's being used, 1944 to 1964. It became a controlled substance, and it was illegal to be used from 1970 onwards. cannabinoid receptors were discovered in 1988 to 1990. The discovery of the brain endocannabinoid system came up in 92 to 1999. In 2020, during the COVID, it was decided that medical use of cannabis is legal in 43 US states and in DC. So the historical content, in ancient use it has been there in India, China and Egypt since long. Many religious customs are there that we are using it there also. 20th century it was prohibited because of the psychoactive effects and misuse of cannabis. Now the perspective of changes that use it for new medical research and public opinion. If we use it correctly, it's very useful. So WHO and UN, what is their standpoint? The World Health Organization says reclassify cannabis under international treaties. It's recommending the removal from the Schedule 4, the most restrictive use. UN has approved the reclassification in 2020, recognizing the medical potential. The global legal status overview, it's fully legal in Canada, Uruguay, Thailand, and several US states. Medical use only is permitted in Germany, Australia, India, the restricted use is there, and UK. So it's illegal in many Asian and Middle East countries. The Golden Triad, it's available easily in Thailand, Myanmar, and Laos. That's the Golden Triad, which is on our east side. The west side, you have it in Pakistan, you have it in Afghanistan, and the eastern part of Iran. That's known as the Golden Crescent. So on this map, you can see where it's legal. Most of US and Canada is definitely legal. Illegal and decriminalized where it's orange, South America and parts of Australia. Illegal but often unenforced, the pinkish color, India. And you have parts next to India, this side also, the eastern side and western side of India. Illegal in the rest of the world, especially Asia, Russia, and the other areas. So cannabis regulatory laws. In US it comes under US FDA. In India it comes under the Narcotics Dispensation NDPS Act. Japan under the Cannabis Control Act. Europe the EMA, and in Canada the Canadian Cannabis Act. So the cannabis sativa leaf extract. On 10th August 2010, the government of India inserted Rule 158B into the Drugs and Cosmetic Rules 1945 via the GSR 663E1, creating the first explicit Ayush licensing pathway for cannabis sativa leaf, Vijaya, in Ayush products. Only the non-psychotic parts, the seeds and the leaves, can be used in medicinal use. They are permitted. The resin and flowering tops, charas and ganja, they are of course prohibited. The recommended dosage, 50 milligram twice daily. Excellent efficacy in the lower dose. So Drugs and Cosmetic Rules Schedules 1945 offers a scientifically backed herbal approach. So this is still actually from Ayush side, it has been cleared. Legalization in India. Status. Cannabis is illegal under the Narcotics, Drugs and Psychotropic Substances Act 1985. Exceptions is Bhang is legal in some states. Ayurveda allows the regulated use. Recent developments, interest in medicinal cannabis and hemp industry has restarted. Jammu, they've already started, started off projects there also. Country's first cannabis medicine project, and it's to pioneer the first cannabis medicine project. They realized that you have Laos, you have Myanmar, and they're all picking up. You have Pakistan, so why don't we become a world leader in cannabis production also? So it's being started off in Jammu. The arguments for legalization. The medical benefits are immense in epilepsy, pain management, chemotherapy-induced nausea. The economic growth, it's a form of tax revenue, job creation, export potential. Criminal justice, they have to be reformed. The law enforcement has to be picked up. Regulation and safety, quality control, reduce the black market trade. These are the things in favor of legalization. The arguments against legalization, health risks, misusing it, addiction, mental health disorders, impaired driving, youth access. You're afraid that once it's being used, maybe the underage will be also using it. What are the regulatory challenges? Standardization, monitoring, dosage control. The social stigma, resistance from the conservative sections of the society. Case study in Canada, it was legalized in 2018. The strict regulations are, there's an age limit, there's a possession limit, and they're licensed producers. The economic impact, it's a over $10 billion industry in the Canada. and the black market is reduced because of the legalization there. Strong legal framework is required. You have challenges in implementing the strong legal framework. You have to train the healthcare providers, monitor the misuse, and balance the access with the control. The future outlook. More countries are exploring the decriminalization and legalization. There's emphasis on the research, regulation, and public education. And there's a role of biotechnology and pharmaceuticals in the cannabis development. So in conclusion, legalization is a very complex issue requiring a balanced approach. Medical potential is significant, but must be accompanied by regulation. Social, economic, and legal frameworks must evolve together. And whatever use we've had, of course, topically, we've been using it now for about 2 years. We've been very happy and we're surprised that people are able to use, they're not disturbed by the smell. They don't complain of any irritation or anything. And some people really enjoy it because they know where it's coming from and they are very happy to buy more of it and suggest it to others. So yes, we have to be careful about the misuse. The biggest problem with this is some people have tried to actually burn it and try to smell it. It's very dangerous for the lungs. So that has to be very well taken care of. It has to be explained to our patients. Don't try to use it as a cheaper form of the resin and the flowering leaves. I thank you for this, and are there any questions? Thank you.
Thank you so much.
So, sir, we are concluding the entire things. See, what we have got it from this particular discussion. Number one is that, yes, this cannabis has a lot of potentials, and it will be really very good for chronic pain, even also in case of epilepsy and sleep disorder and depressions. Second one is that it basically acts on our endocannabinoid system. But when we take the extract, we are taking the extract from your leaves. Leaf extract, we have to see the concentration of CBD and THC. Always CBD should be higher side as compared to your THC when we are taking care of the chronic pain. But when we are going for your epilepsy, there obviously THC will be higher side. Second one is that when we are taking into consideration CBD higher side, it acts on only CV2 receptor. It doesn't have any effect on CV1 receptor, so there will be no psychoactive effect, but there will be a pain relief. And we have seen the legalization, particularly this cannabis, it has been approved in Ayurvedic proprietary medicine. It has come in the Schedule E1. And secondly, it is NDPS Act, it has been removed only the leaves, but flowers, it has not been removed from NDPS Act. It is under NDPS Act. And secondly, there are different formats are there, starting from your oil, gel, spray, even also oral form. There is a 3 formats, tablet, capsule, and gummies. Even also oral tincture is available, where the absorption will be really good enough, and the result is very promising. So in India, it is only approved as a medicinal purpose. It has not has been used in case of recreational purpose. Whereas there are certain countries where it has been approved as a recreational as well as medicinal purpose. We have seen that in case of Canada, Uruguay, it is Thailand, it is both recreational and medicinal purpose. But India, only the medicinal purpose, it has been approved. So this is almost a lot of things, but we will get a lot of insight for this cannabis when you will use in your day-to-day practice, when you will get the feedback from the patient, and you will also find that yes, how much effective, and is there any side effects you are coming across or not. We have seen that a lot of drugs, a lot of things, initially we launch, we don't find any side effects, because when we launch, the sample size is very small. When we use a lot of patients, then we come across that yes, it has a side effects, and later on it has been withdrawn from the market. So still it is debatable that how much it is effective and how much it will be promising. So our use and our feedback from the patients will give us the new trends. Thank you very much for attending this session.
Thank you, sir. Sir, in fact, it's been a great evening. You have all have made to this program. I think we are so fortunate to have such an august gathering. In fact, and I think the all who's who of the orthopedic and the medicine field is here and under one roof. And InnovCare as a company can't be more fortunate, to really host you all. It's been a real pleasure for us, and I'm sure this would have given lots of insights to each one of us, and a new avenues for trying to, relieve, chronic pain management as well as the acute pain management with the help of medical cannabis. Currently, as sir has already rightly mentioned, we have introduced in the spray form. We have an oral form which is not a non-cannabis source but acting on cannabis. We have an Emulgel form. We have Instaactive 4 tablets, Instaactive oil is there, Instaactive spray has also been launched, Instaactive patches is the most promising, which is very soon going to be launched in the first or second week of August. So before I will close the session, but would like to do some honors. So so I request sir for our chairperson of this meeting, Dr. Arun Goel sir. So please, sir, come and accept a memento from our side, sir. So Dr. Arun Goel sir, please. Sir, please. Thank you so much, sir, for inviting us and supporting us. Sir. Thank you very much. Now I request my colleague, Mr. Suman. Suman, can you please give a memento to our guest speaker, Dr. D.K. Chauhan, sir. Sir. Thanks, sir. I'll request my colleague Chandan to please come here and honor Dr. Sanjay Kapoor. Sir, please accept a memento from our side, sir. In fact, Dr. Arun Goel has been very fortunate, who has given us the, the direction for the meeting. Dr. Chauhan has given us the insights. Dr. Sanjay Kapoor has spoken very well about the role. And now I'll request Mr. Harish to please honor Dr. Raju Kalra, who has, in fact, given us the overall perspective as the legalization of the cannabis, medical cannabis in the country. Thank you, sir. I'll request Rajneesh. Rajneesh is there? Yeah, Rajneesh, please come. Like to honor Dr. Himanshu Gupta. Sir, right, sir. Sir has been a guiding force for, he has guided us how the clinical trials to be conducted and how it is to be used. And we have been very fortunate for your guidance. So please accept a memento from our side, sir. Thank you very much, sir. Thanks. I'll request Aman to be here. Aman is there? Aman, please come. I request Aman to present a memento to our guest of honor today, Dr. Manoj Vats. Sir, please, please accept a memento from our side. Sir has set the ball rolling in the beginning, and please. Thank you so much, sir. Thanks a lot, sir. Thank you so much, sir. Yeah. Yes, sir. Now I request my colleague, Mr. Prem, to please come and honor Dr. Bijoy Dev. Dr. Bijoy Dev has been our, instrumental force guiding force behind the introduction of the medical cannabis as a medical director in Innovcare, and also driving this meeting. So I request Prem to honor Dr. Bijoy Dev. Thank you so much, sir. Right, sir. So with this, sir, I request you all that you please join us for a dinner. And now an informal discussion and informal meeting will start. And I would say that your real meeting with amongst your colleagues and with us begins now. Okay, so so thank you so much for all of us to be here. So now it's an open session, and now it's we can freely request. Yeah, and request. So please enjoy your evening. Thank you so much. Thanks a lot, sir. Please come and join for the dinner, sir. Thank you so much, sir.